Kia ora, tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Julia Slark taku ingoa. Kia ora and welcome. My name is Julia Slark and I'm the head of the School of Nursing at the University of Auckland in New Zealand. And I'm the chair of the U21 Nursing and Midwifery Disciplining Group. We are part of the U21 Health Sciences Group, which was established in the year 2000. The group was created to provide U21 staff and students with a framework for exploring opportunities for global collaboration in research, information exchange, and the sharing of resources across the health sciences sector. In order to celebrate 2020, the Year of the Nurse and the Midwife, the Nursing and Midwifery Group decided to develop and host a three-part webinar series titled Professional Nursing, Past, Present and Future. Normally, an initiative such as this would only be available to U21 member universities. However, we felt very strongly, given it is the Year of the Nurse and the Midwife, that this webinar series should be available to anyone who is interested to celebrate nursing and midwifery. And we would also like to take the opportunity to acknowledge all those who have contributed to the global response to the COVID-19 pandemic. This is the first webinar of the series, and we are very excited to present our webinar to you today on the 12th of May to celebrate International Nurses Day. Our webinar today is entitled Nursing in the New Era of Infection and Communicable Disease, 2020 and Beyond. If you're on Twitter, please do tweet the webinar using the hashtag U21Nursing2020. It is now my great pleasure to hand over to our host, Professor Marie Gertz, who is the head of the Department of Nursing at the University of Melbourne in Australia. Marie will walk us through our hui today. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Over to you, Marie.
Thank you, Julia, and it's my great pleasure to welcome everybody to the University of Melbourne and to this inaugural webinar of the U21 Health Sciences Nursing Special Interest Group on what is the most incredibly important milestone for our profession. I wish to begin by acknowledging the traditional custodians on the land on which I am working today, and that is the Wurundjeri people of the Kulin Nation. And I recognise their enduring connections to the land, water and community. I pay my respect to Wurundjeri leaders past and present, along with Aboriginal elders of other communities who also may be present with us online. Now I want to move on housekeeping matters. So we'll go to the next slide, please. Before we get started, just to give you a quick overview of our webinar, we're really proud to be hosting this webinar, which is informed by Professor Anne Kurth's keynote. For technical reasons, we've pre-recorded this webinar, but Anne is also with us online today and is participating in the panel. We will then invite each of the four panel members to speak for several minutes about their experiences as nurses and educators throughout this pandemic. Our aim here is to share and learn from the experiences of our international counterparts in respect to the role nurses play and continue to play in preventing, predicting and responding to COVID-19. I'll then facilitate a panel discussion. We'll have an online audience today. It's truly international. Because of the size of this audience, we have got the chat function working and we have some pre-arranged questions which we'll be talking through. For the best viewing experience, you should set your Zoom to speaker view rather than gallery view. You will also be able to download the video from the U21 Health Sciences Group website in the coming days, and we'll send you the link when that becomes available as well. You have the next slide, please. When 2020 was declared by the World Health Organization as the International Year of the Nurse and Midwife, no one could have imagined the global health crisis that was about to unfold. In the context of a global pandemic then, it's therefore really fitting that today, May 12, we commemorate 200 years since the birth of Florence Nightingale. Nightingale was a woman, a social reformer, an innovator, a statistician, an educator, and a tireless advocate for improving public health. Her social reforms included improving healthcare for all sections of society, advocating for better hunger relief in India, for example, helping to abolish prostitution laws that were harsh for women, and promoting female participation in the workforce. She also is credited for giving nursing a favourable reputation and became an icon of Victorian culture as the lady with the lamp. The nursing profession has continued to play a significant role at times of crisis, for example, at wartime and during the 1918 to 1920 Spanish flu pandemic, in which up to 50 million people are believed to have perished. Today, nurses go to work as trusted and respected healthcare professionals. Stronger than any PR campaign, this global pandemic reminds us about the public value of nurses and nursing. Cameras have shown the usually private world of unwell people across the globe requiring our expert care. If nurses have been in the past almost invisible in medical discourse, COVID-19 has put them under the global spotlight, caring for the sick and saving lives. This year, the theme for International Nurses Day is Nurses, a Voice to Lead. The theme focuses on the need for nurses to become more active in and vocal in policy development and in implementation. And nowhere is the need for our leadership more important than in the area of planetary health. So, to our panel members, can we have the next slide, please? It is a great honour to welcome our esteemed international colleagues and panel members. We have Associate Professor Nolene Bennett of the Doherty Institute here at the University of Melbourne. We have Professor Jiajin Ling from the University of Hong Kong. We have Associate Professor Soo Kyung Park from Korea University and Professor Hu Yan of Fudan University, China. And it is an absolute pleasure now for the next slide to introduce our keynote speaker, Professor Anne Kurth, Dean, and Linda Koch-Lorimer, Professor at Yale University School of Nursing. Anne is a Professor of Epidemiology of Microbial Diseases at Yale School of Public Health. She's an elected Fellow of the National Academy of Medicine and a Fellow of the American Academy of Nursing, an epidemiologist and clinically trained nurse midwife. Her research focuses on HIV and reproductive health and global health system strengthening, particularly in the context of climate change. Let's now hear from Anne and her presentation and then move on to the panel discussion. Can we start?
Thank you. I'm deeply honored to have the opportunity to learn from all of you. I'd like to thank Professor Gertz, the esteemed panelists, the U21 network, and all of the attendees as we gather during what is a true human crisis. My name is Anne Kurth. I'm Dean of the Yale School of Nursing, and I'll be speaking briefly on the topic of nursing the planet. In our time together, I want to review the planetary health framework, focus in on the case study of COVID-19, SARS-CoV-2, which is an example of a planetary health issue, and talk about the nursing response and implications for the future of nursing. On the day that I'm recording this with you, on April 23rd, there have been over 2.7 million infections and over 780,000 deaths worldwide. Undoubtedly, those numbers will have gone up by the time you are hearing this. There are a number of challenges that we face around the globe in every level of resource setting. Some of these were alluded to in the outline for today's session. They include, of course, rising waves of non-communicable diseases, emerging and re-emerging pathogens, of which COVID-19 is an example, the displacement of populations involuntarily for many reasons around the world, aging, urbanizations, and others that you might think of as an important topic. It also includes climate change and ecosystem strain, and I would hope that we would keep our eye on that issue. because that, prior to COVID, was really the existential crisis in front of us. The Intergovernmental Panel on Climate Change has produced reports over the years, always qualified very carefully, as scientists do, noting the connection between human activity and global heating, global warming, and global damage. And every time that they produce such reports, they state that this connection is there with increasing certitude. And in 2018, they put out a very important and seminal report basically indicating that if we do not hold our human-induced warming to no more than 1.5 degrees centigrade, we would face enormous consequence, and that we need to take drastic societal action in the next decade in order to hold the warming trends down. Climate change is really but one example of the planetary health framework that has been evolving from environmental health, which nursing has always been engaged with, the One Health framework, which incorporates animal health, veterinary science, as well as human health and science, into the broader framework around environmental damage and ecosystem impairment caused by human activity, and that's in a variety of ways and mechanisms, including deforestation, desertification, loss of wetlands, and huge loss of biodiversity. Water will be the next resource that is highly constrained. Urbanization, which has pluses and minuses, both for people and for the environment. And then effects on reefs, which of course you in Australia know very well. These stresses that have been created by the way we live our lives, in our industrial impact, in our massive agriculture, monoculture, and industrial farming, and other economic patterns, have led to a variety of health impacts. These are direct health impacts, such as rising sea levels and floods, heat waves, pollution, which kills 8 million people a year from preventable pollution, ecosystem-mediated impacts, including infectious disease and new pathogens, and malnutrition of different sorts, and indirect health impacts, including population displacement, and higher levels of intrapersonal and interpersonal strife and conflict. This planetary health framework came out in a Lancet Commission Rockefeller Foundation report several years ago, and increasingly is being used in nursing and other health sciences. As with many health issues, we know that climate change and other planetary stresses, including pandemics, can affect everyone, but generally not always equally. So here in the United States, we are seeing already that COVID-19 is disproportionately affecting communities of color, socioeconomically more vulnerable communities, of course, older adults. And these are patterns that we see for many of these planetary health stresses, including climate change and, of course, COVID-19. So turning to COVID-19, it's really a textbook case in many regards of the link between planetary health, planetary ecosystem stresses, and novel emerging and reemerging pathogens that can affect human health. This, of course, was a zoonosis, a virus that made a jump from a natural host reservoir into another animal, and from there into the human species. And of course now is human-to-human community transmission. We saw this with HIV, SARS, with MERS, and again, much of this related to the way that we live our lives as individuals and societies. So urbanization and deforestation changes the ecosystem and pushes humans into other animals' niches, and then that allows more interaction for possible pathogen transfer. So let's think about human population growth. That certainly is continuing. We're going from just the last century and a half, from 1 billion, now projected to be almost 10 billion by mid-century, mid-21st century. This means that the human population not only grows in absolute numbers, but also in where we live, which is in cities. And of course, we are seeing now more people living in cities than in more rural areas, particularly in the Western Pacific Asian region, as we see here. cutting down the trees changes where the bats can roost. So they might be roosting in the backyard of someone's village and thereby exposing people in that village. And this is what we saw, of course, with Ebola. This is the tree where the toddler was eating a piece of fruit that had probably bat droppings on it, and that was the most recent Ebola outbreak. So this greater interaction that's forced between humans and animals really is something that we're inducing, and taking a more planetary health framework that cuts across silos and sectors is going to be important. And this is just a recent quote from colleagues at The Lancet regarding that planetary health perspective. So in total, I think we can recognize all of these issues that have come into play with this most current zoonoses of COVID-19. Now, we know that nurses are heavily engaged in the COVID response everywhere around the world, and this is true despite the lack of personal protective equipment, variable availability of tests and contact tracing, some of the classic public health tools, and of course, as of now, not well-identified treatments. Stresses on health systems, including hospitals, not just for ventilator support, but for critical care nurses who can run those ventilators and keep patients safely engaged during their acute crises. So we're certainly seeing in the United States a push to increase the nurse workforce, bringing back retired nurses, trying to graduate new nurses even more quickly, lifting of the scope of practice restrictions that we've had in the United States, and that may be the case around the world as well in your own country. And so those may be some silver linings out of this response, a recognition of what it is that nurses do, the importance of us as a foundation of the health system, not just for a crisis like COVID, but for everyday care, and including our connection with the community. So certainly there's been an acute care focus with COVID, but it really brings us back to our origins with Florence Nightingale and her perspective on environmental health as being a part of human hygiene and health as we respond to this epidemic. And of course, there have been people who have already lost their lives, health workers, including nurses. And we know nurses are needed for the world, not just for intermittent pandemic crises. Just recently, the World Health Organization was able to put out the very first report, State of the World's Nursing. I like this infographic because it points out all the different roles and ways in which nurses and midwives play crucial roles in the community for prevention, for treatment, for research, for policy. But what the WHO report summarized is really first some data on where we are as nurses. There are 28 million nurses worldwide. We are the single largest cadre of health professionals everywhere. 19 million of us are professional nurses. There's still a gap, however, and we need to educate 6 million more, particularly for low-income country settings, low and middle-income country settings. In the Western Pacific, where you all are located, you have about 7 million. So you're actually pretty balanced, given that you're about 22% of the world's population and you have about 25% of the global nursing workforce, according to the WHO report. Not dissimilar to some other high-income countries, a third of nurses in the Western Pacific region are practicing in a country different from where they were born or trained. And 90% of all nurses around the world are female. In the Western Pacific region, it's 95% female. So I think we have to always still be aware of the gender issues because it does come into play in terms of representation and equity. And we cannot, as nurses, neglect the mental health and psychiatric needs. Certainly during this COVID crisis, there are many populations that have pre-existing psychiatric needs, substance use issues, and we worry, of course, with a lot of the social and physical distancing and lockdowns of the economies, that intimate partner violence, child abuse, and other forms of violence would rise. We are concerned about health worker burnout and ability to be resilient, especially through a crisis such as this, which was going to leave a mark that is very traumatic, having to make decisions about who gets ventilators and who survives, seeing a lot of death in a short period of time, as we saw with the HIV pandemic and with other outbreaks, can be very traumatic. So we do worry about that, particularly for our healthcare workers. The UK has put forward a psychological first aid guidance, for example, that can be useful. Another thing we're seeing with the COVID response is people trying to move to more telehealth delivery. Since phones are in such abundance around the world, the ability to do ambulatory care, psychiatric care, assessments even at the individual or group delivery level is increasing. And I think that may be something that perhaps will persist after the pandemic we get through this first wave of the pandemic. And that might be something that's useful. Do we have to have every patient come into a clinic and sit and wait in a waiting room? Telehealth will not be good for some other patients, however. So we need to understand when do our patients need and clients need that face-to-face assessment, contact, connection, and when can we do some care, at least routine care, through telehealth? Might that be more efficient? And I think we need to always be aware, again, of course, of vulnerable populations. Loneliness is emerging as a real substantive health risk. There have been studies equating the impact of loneliness on health outcomes as being the equivalent of smoking 15 cigarettes a day. So understanding loneliness that occurs in many populations and societies and being able to screen and do outreach for that, I think is very important. I mentioned the surveillance that we should be doing around violence, interpersonal violence, and we do need to think about strengthening the mental health system, which is often neglected. And we need to care for ourselves throughout all of this, stress, burnout, and maintaining a sense of hopefulness. Again, because inequities are always accentuated, all the cracks in a society and a health system come out during a crisis like this. We are seeing that interventions that might be available in high-income country settings are not going to be feasible in lower-income country settings. This includes the societal lockdowns that have been promoted around the world and that can be a tool to reduce transmission of COVID. But when you're talking about being in a mega city urban slum without any access to daily living, food, water, this becomes extremely difficult to think of using that as a tool. And then being able to have some of the, not just critical care beds and ventilators, but even just oxygen and sinks and running water to wash hands becomes an issue. We've seen it certainly in the United States, a real bidding war for personal protective equipment and for test reagents and other elements of response to the COVID crisis. And it's really demonstrated how incredibly reliant we all are on these very distributed supply chains. So I think we're going to see some changes in that after the COVID crisis also. The WHO and the Africa CDC have put guidelines together focusing on physical distancing and other standard tools. But again, we need to be thinking about what are the lower income and more vulnerable populations actually going to be able to do and what services do they continue to need, including around sanitation and vaccination and all the services, including maternal health, that must go forward even in the context of a pandemic. Certainly in a number of places, calls have been put forward and some government policy has been made to try to freeze the idea of evictions or renters being pushed out of their homes during this crisis period of lockdowns. We need to protect our protectors. We need to protect our healthcare workers by providing PPE and test availability. There have certainly been problems with that, at least I know in my country, the United States. So in terms of thinking about health equity, which is a framework we always care about as nurses, we need to be thinking about generic medicines, supplies that are equitably available and not sort of poached by the higher income bidder. People have called for relaxing patents related to COVID treatment so that we maximize the availability of actual treatment once we know we have some effective therapies. And as we think about those populations that are most in need, including refugee camps, detention centers and prisons, and high poverty communities. So we're all quite familiar, and it's very interesting to see how the general population now understands this idea of flattening the curve, of trying to spread out the distribution of this infection so that the health system does not get overwhelmed and can continue to meet the surge needs of patients as they come in and not become overwhelmed by being able to distribute it more evenly over time. And we're seeing variation with that in countries around the world. This is Australia's data as of last month in terms of flattening the curve and plateauing on new cases. But I just want to make this point here. We're currently feeling absolutely overwhelmed by the wave of COVID-19, and that's the surf that's right in front of us, the churning and all-consuming surf. But let's look out over the ocean and the horizon and see what is still coming, and that's the larger issues of planetary health stresses, including climate change, climate warming, global warming. So I show this picture just to say there are several curves to be thinking about, and not just for COVID. And we have an opportunity to choose our future. One other silver lining of the COVID crisis is that it's showing us how reducing our economic levels can reduce our fossil fuel use, our greenhouse gas production, transportation use, and it's giving us a tiny, unchosen, and not something that people wanted to see, but it is giving us an experiment to show us how we might be able to shift more towards a green economy and choose a future that is not only better for the planet and for the ecosystems on which we all living things rely, but for humans, and so that we would have a good Anthropocene, a good human-induced era, as opposed to something that is more dystopian. So just coming back again to our challenges, what are some of the solutions? Certainly the need to strengthen our health systems is one approach. WHO and the World Bank and others have put together the health system strengthening framework. They've updated it to take into account climate resilience, the need for climate resilience, addressing climate change, new pathogens, pandemics, all the elements that we talked about in that planetary health framework. Certainly you need all the standard building blocks to create more climate smart health systems, or more resilient health systems, we might say. And nurses should be leading, and can lead, and are leading that kind of resilience in health systems, locally and regionally and internationally. And I'm sure many of you at this meeting, listening to this webinar, have done very interesting things in your own country and in your own settings in this regard. We can partner with local decision makers, policymakers, public health colleagues, government officials. We need to also be that link to provide anticipatory guidance to patients and communities, because we are trusted as health providers. We need to help our health facilities not only have a greener footprint, which is mitigation, but adaptation. We need to have our health facilities prepare for these surges in demand that come with a crisis like COVID, or with a flooding, or with an influx of people who need mobile health care in terms of refugees. And that focus on population health and that health systems perspective really brings us back to the origins of nursing as a profession. I would argue that not only do we have our excellent clinical skills and our prevention focus, but we're as a workforce and as a personality type that chooses nursing, we do tend to be optimists. We're pragmatists, which is also quite useful in a crisis. We believe in advocacy as a part of our very functioning and our professional identity. We care about addressing inequality and going for more health equity. We can be leaders, both for science and for application of evidence to better healthcare delivery. We work for people. We work with people. We can be a bridge, and we can be the glue, working with communities. And that is absolutely crucial, as we know from Ebola and other responses to pandemics. You must work with the community at risk. So what are the implications for the future of nursing? I would say COVID-19 is an absolute primary example of the planetary health crises in front of us. There will be more of these crises. We should be better prepared. and nursing has to be supported to be a full and contributing part of the response, allowing us to practice everywhere to our full scope of training, keeping us protected with personal protective equipment and the tools that we need in order to deliver prevention and care. We have to have that population health focus as well as working with individual patients in front of us. And we know from the WHO State of World's Nursing report that we need to scale up education. So we're not quite doing our job yet in terms of producing the numbers of nurses and midwives that we need. And we have to address that shortfall. And I think that is another element of the COVID crisis, which has forced many of our schools of nursing to shift to more online education. What elements of virtual and distance education can we continue in order to make our nursing education perhaps more efficient? Because we do still have to make up that shortfall. We are not producing enough nurses. So all of these lessons, we hope, good, bad, and ugly, we can apply to the future. Here in the U.S., we have a Nurses Climate Challenge. I just put it here because it's an example of how we're trying to activate nurses to address policymakers around the challenge of climate change and global warming. And there's just a toolkit there that might be useful in your own country, potentially. And I think we have a lot to learn from our colleagues and nurses and clients and patients and advocates who went through the last major global pandemic that started as a zoonosis, and that's HIV. This is a book called How to Survive a Plague, the story of how citizen activists really changed the face of the way we do science, the way we work with communities. And so I would say we have the opportunity in the midst of this COVID crisis to put together our own action plan, to influence policy, to reduce our impact on planetary stresses in our daily lives, as well as at the larger scale in terms of our economies and our societies. And we have the Sustainable Development Goal framework to think about that. Certainly, this COVID crisis has pointed out how interdependent we all are as human beings and across the globe. And we are seeing all the cracks and inequalities coming out during the COVID crisis. But the world can be different, and it needs to be different. We need to turn the pain of this pandemic, as we have with the HIV pandemic, towards making a safer, more equitable, and just world after this first crisis of the COVID pandemic is over. I thank you for your attention. I thank you deeply for the work that you do. I look forward to the panel. Thank you.
Thank you, everybody. Now, I sent a message to everyone online to keep their cameras and off and their mics on mute. You will see us as the panel members speaking now, but without further ado, I would like to introduce my dear colleague, Associate Professor Nolene Bennett, who is a Senior Infection Control Consultant at the internationally renowned Doherty Institute for Infection and Immunity here at the University of Melbourne. And Nolene's going to speak about the Australian experience. Thank you, Nolene.
Thanks, Mary. It's a privilege to be part of it today. I have the next slide, please. Next slide, please.
Start talking, Nolene, and our technicians do that job.
Oh, sure. So the first COVID-19 confirmed case was identified in Australia in late January. There are now about 7,000 confirmed cases. About 2/3 were overseas acquired, and there have sadly been about 100 COVID-related deaths in Australia. Now, Australia has some advantages as it aims to flatten the curve and thereby not overwhelm the health care system. It's a large island nation with borders that can be locked down. It's inhabited by a comparatively small population that mostly live in low-density cities. It's lucky enough to have a highly developed public health system and the government sufficiently solvent to be able to provide economical support for its population during months of lockdown. Now, numerous public health interventions have been instigated, and this includes case identification. So unless requested as part of an outbreak management or enhanced surveillance, a set of clinical and epidemiological criteria used to decide if a person should be tested for COVID-19. Case isolation. Persons with suspected or confirmed COVID-19 must isolate in their home or in hospital unless they're no longer infectious. Contact tracing and quarantine. Well, persons who have been in close contact with a confirmed COVID-19 case or who have arrived in Australia after the 15th of March must remain in mandatory quarantine for 14 days. Hygiene improvement, both personal and environmental. Travel restrictions. Australia closed its borders to all non-citizens and non-residents back on the 20th of March. And physical distancing. All Australians are required to reduce close physical contact with each other. Next slide, please. So there are about 380,000 Australian nurses. They're the single largest workforce in Australia, and they work across all healthcare settings and all stages of the human life cycle, pre-birth to the end of life. They have many attributes, including, thankfully, adaptability, attention to detail, critical thinking, confidence, commitment to development, communication, compassion, ethics, and stamina. Most Australian nurses in their role care for one or relatively few clients at a time, but during the COVID-19 pandemic, they've had to extend their role to the entire population, especially those persons in the communities where they live and work. They've been working collaboratively to support and lead public health interventions and have been involved in many activities related to prevention, education, assessment, surveillance, and research. To be able to do this, they have had to understand what is COVID-19, what are the clinical and epidemiological criteria, who is at risk, how is it transmitted, how is it prevented, how is it diagnosed, what is potential clusters of infection, and how is it managed. Now, if I can just drill down to how it's prevented. Many Australian nurses have had to revise their knowledge and or improve their practices related to hand hygiene, respiratory hygiene, environmental cleaning, personal protective equipment, so that's the correct use of eye protection, masks, gowns and gloves, physical distancing, and clinical assessments for COVID-19 criteria. During the COVID-19 pandemic, it has become really clear to Australian nurses just how important these fundamental infection prevention and control precautions are. I am hopeful, as it should be, that they will continue to be appropriately and meticulously applied beyond the COVID-19 pandemic. Thank you.
Thank you, Nolene, for your presentation. It's very much a back to the future message from Florence Nightingale, isn't it, about the importance of hand hygiene and infection control in the most fundamental ways. It does take us back to the days of sanitation science. So thank you for your presentation. I now call upon Professor Jiajing Ling, who is Professor and Head of Nursing at the Hong Kong U School of Nursing. Welcome, Jiajing.
Thank you, Marie, for your kind introduction. It gives me great pleasure to introduce the Hong Kong experience in response to COVID-19 from a nursing perspective. I'm Jiajing Ling, the Head of School of Nursing, University of Hong Kong. Next, please. Hong Kong could easily be hit hard by the COVID-19 pandemic simply because Hong Kong is densely populated with a huge aging population. Hong Kong people enjoy the longest longevity in the world. Hong Kong is an international travel hub and it has close border traffic with mainland China, where the virus first emerged. However, Hong Kong has so far maintained a relatively few cases, As of yesterday, there are a total of 1,048 cases with 4 deaths. Hong Kong has not had a case of local transmission in the past 20 days, and we are currently cautiously resuming normal life. This does not come overnight. This is from a hard-earned lesson we learned from SARS experience in 2003. So medical experts and health professionals are quick in response and be prepared. People are well prepared to practice infection control measures such as face masks, hand hygiene, and environmental cleaning. Hong Kong's success in containing the virus through identifying cases, field tests as early as possible, isolating cases and tracing patients' close contacts, and quarantining in specific facilities. Hong Kong has also adopted stringent social distancing measures since January, including closing of schools, flexible working hours, and working from home arrangements, partially closing borders and restrictions from travelers arriving from affected regions, and also restrictions on mass gatherings. And this experience have also provided important lessons to other countries or to other cities around the world. Next, please. Nurses are always at the front line of any health crisis, including the COVID-19 pandemic. Hong Kong nurses have played an important role in response to COVID-19, including advocate and influence politics. A letter to the Hong Kong government and chief executive was issued by the Hong Kong Academy of Nursing Limited in January 2020 to call for closing of the borders to prevent the spreading of COVID-19, proactively tracing the source and potential carriers, provision of adequate stock for full PPE and enough isolation facilities, and immediate and practical measures such as manpower arrangements, subsidies, insurance, and contingent accommodation, etc. Learning from SARS is important to ensure check and balance. So a hotline was set up by the Association of Hong Kong Nursing Staff for nurses to report on the PPE resources in respective hospital clusters. There are 970 complaints received and referred to the hospital authority for follow-up. Nurses care for patients at frontline, provide mental health care to their family. As there is no visiting hours in hospitals, nurses are using cell phones and electronic tablets to update family members of patients' condition. Hong Kong nurses have done a fantastic job in knowledge transfer among nurses and educate public and community, especially for nurses with SARS experience. Hong Kong U School of Nursing, as the leading school in Hong Kong, we took the lead to produce educational material to the public. Videos produced by our staff and students to debunk myths on infection control and advice on social distancing mental health. These videos went viral on social media and were shared by the community locally and globally. We provide infographics on proper hand hygiene and advice on psychological well-being. We launched a website to provide anti-epidemic tips. We conducted research related to the COVID-19 to prepare ourselves in order to meet the challenge of the future health crisis. During the pandemic, it's also extremely important to stay connected with the community. So, sponsored by the Hong Kong Jockey Club Nice Link project, our school provides online courses to empower elderly service workers. We also provide bi-weekly nurse-led telecare to socially isolated older adults, and leaflets were distributed to these elderly. Last but not least, we reach out proactively to our nursing alumni to pay tributes and support our fellow nurses at the front line who have demonstrated respectable professionalism during this devastating outbreak. Next, please. Thank you very much for your attention and wish all of you a happy International Nurses Day. Thank you.
was really, really interesting. And now I'm going to, if we could have the next slide, please, introduce our esteemed colleague, Dr. Sue Hyung. She is Associate Professor in the College of Nursing, Korea University, South Korea. Welcome, Sue Hyung.
Hi, everyone. I'm Soo Kyung Park from Korea University in South Korea. Nice to meet you all through this webinar. First, I'm gonna talk about our situation with COVID-19 in Korea. Our first patient was reported in January 20th. And after that, right now, for today, there's 11,000 cases. And then among them, 242 people died. So in this situation, we were able to initiate drive-through or walk-through system so that we easily and safely perform the coronavirus PCR test. As you see in the picture, the left part, upper top picture shows drive-through system, and then bottom picture shows walk-through system. And then picture in the left side, right side shows some smartphone app application that we developed during this process. So with this drive-through or walk-through system, nurses were able to get specimen for COVID-19 PCR test while patient was in the car and was in the booth. So that way, we can minimize contact with patients with possible infection. And we monitor patients in high-risk group because we have outbreak for a short time. And all patients were not able to be hospitalized, so we use residential treatment center, which means we use it hotels or other buildings for patients to stay there, especially for low-risk group. Can you, we develop criteria to determine who is high risk and low risk group. So high risk group includes elderly, those with chronic disease and smokers. And so nurses in capital in Korea monitored the group of people in this residential treatment center every day. And we also monitor high risk group in hospital. And they had to stay there for more than 14 days until COVID-19 tests becomes negative. So they had anxiety, fear, or breakdown. So nurse had to support them psychologically. And we also provide public education on disease prevention, such as avoiding social distancing and personal hygiene. Can you show me the next slide, please? So challenge during this outbreak could be limited hospital and healthcare provider. Previously, I mentioned about residential treatment center, but there are limited personnel who takes care of this patient. At the time, we used telehealth to monitor patients who stay at this residential treatment center. I think telehealth was useful and helpful to rapidly deal with this health demand during this pandemic time. So what is the implication for future nursing? So we should educate more about pandemic during this outbreak. We became familiar with online education, so we could develop more web-based program in the future. And we need to emphasize population-based nursing and preventive nursing for future new pandemic, in addition to chronic disease management. And we also we developed some self-diagnosis app in the smartphone, which includes information for COVID-19 symptoms and information for a screening clinic in Korea. For those who arrived in Korea in airport, they should install this app in the smartphone, and they should measure their own temperature and assess the symptoms. And then they should enter those data in the app, smartphone app daily. If someone enters yes to COVID-19 symptom, this result is transferred to Korean CDC and Public Health Center. So in the future, we could develop more informative app and then program for pandemic. And before I finish my talk, I would like to mention this picture. This picture showed nurses who had bandage on forehead covering pressure injury caused by wearing face shield for a long time to take care of patients. So we should thank for nurses who actually stays with the patient and takes care of them at bedside. So thank you for your attention. Thanks.
Thank you so much. And now over to our fourth panel member, Professor Hu Yan. She is Dean of the School of Nursing at Fudan University and Director of Fudan University Centre for Evidence-Based Nursing. She's also Acting Chair of the CMB China Nursing Network. Welcome, Hu Yan.
Hello, it's my great pleasure today to join at the special National Nurse Day to join the webinar. And I'm going to share my understanding about the role of nurse in the pandemic of COVID-19. And here in the screen, we can see so many pictures that nurse produce a lot of, they are heroes of the national heroes during the pandemic. And here is a picture, very warm picture. Here is a great story that the humanitarian care is the one part, very tender part and warm part during the process, during the journey of caring people with COVID-19. There is a story in March 5th, the health professionals who accompany with 87 years old COVID-19 patient. They are going for CT scan, and on the way, they stop on the way and enjoying the glorious sunset with the patient. Because the old patient had stayed in intensive care unit for almost 1 month. And it is such a tender, loving moment that people are together, care, and we have hope together, warm each other. So that is what I'm going to share with each other, that's the role of nurse during the pandemic of virus. Next slide, please. In the process, all the process of the pandemic, nurse provide a lot of care, evidence-based nursing care in the disease treatment and also care. And also nurse take rigorous measures to prevent the infections outbreak in hospital and also in the community. And most importantly, nurse in China and in other places in the world meet patients' physical and psychosocial needs and provide palliative care to the patient during the end-of-life stage, and also strictly maintains the occupational safety and the coping with the virus. So that's the key roles of nurse in patient and family education, infection control, and quality of care provider, and especially the humanistic care advocator. Next slide, please. So what is our response to this communicable virus pandemic? So for professional nurse, for the knowledge and the skills and the belief and the visions, how to prepare our nurse in the next pandemic or virus, we should reflect on how to prepare our nurse, the core competence of nurse, and also the curriculums of nursing program, what we should prepare for our new nurse, and also thinking about the teaching and the learning models, the big adjustment during these 6 months, or online, and also mixed method of teaching and learning, that's put a lot of challenges for nursing education, but also we learn a lot from this experience. And also nurses should prepare themselves in the global health issues and dealing with the significant public health event, and learn to effectively cooperate with multidisciplinary teams. As we in Wuhan and in Hubei province during the pandemic, nurses, they account for 70% of the health professionals support Hubei province during the pandemic, and almost 2/3 of the health professionals are nurses, and they cooperate with multidisciplinary team, and we learn and we grow from this whole process. So that's what I'm going to share, and it's a big event, and people and the nurses in the world have to work together and support together. Thank you very much.
Thank you so much, Hu-Yan. So can I ask the panel members to please turn their cameras on and their mics on, because we're going to now have a panel discussion. So I can see some of you here. There's Anne. Everybody's present on the cameras. So I'm going to ask each panel member a question, and my first one is to Anne. Anne, thank you so much for your presentation and for joining us at the late hour in the evening in New York. Now, you in your presentation emphasised the importance of the environment, and particularly the degradation of the environment, and how humans have had this negative impact. And particularly you made mention of the rise of zoonotic diseases, these new novel infections that seem to be evolving at a great rate. I'm interested in the notion of One Health and how you see that in regards to nursing, and how nurses might engage with this notion of One Health to affect change.
Thank you, Marie. You know, these are really, in many regards, not new ideas, right? I mean, Nightingale herself really saw the link between the environment in which people live and work and their health outcomes. The eco-health movement has been around for some time. Many nurses have contributed to environmental science. The One Health movement brought in our veterinary colleagues, and I think that is a very important collaboration. And now, of course, we're seeing more of this planetary health movement, and it's really being fueled by nurses and other health workers being a part of that framework, when having allies not just in healthcare, but across sectors. So we have to be thinking about food, not just health. We have to be thinking about energy and systems of transport, not just health. We have to think about equity and advocacy and governance issues that also affect planetary health. We can certainly work on greening our units, making our healthcare delivery more, less of a footprint on the earth. But we also have to work on adapting our health systems to be ready for these pandemic, zoonotic challenges and other challenges that will come. And that is that kind of global framework that I think reminds us that we're not the only animals and species on the planet, and we have to learn to live in better balance.
Yeah, thank you. It's that interdisciplinary linking, isn't it, between our colleagues, our medical colleagues, our colleagues in areas of infection prevention and control. It's local policy, it's local action, it's also government. And nurses, I suppose, International Year of the Nurse and the idea of voice to lead really speaks to that we need to take a leadership role in our health services around planetary health. Now, my next question is for Professor Hu-Yan, and particularly as China is quite advanced in the ways in which they have managed their lockdown and then the easing of social distancing. So it's timely to consider how we might monitor potential outbreaks in the community and spikes. And certainly here in Australia, we're thinking about that very carefully and planning for that now. So Hu-Yan, given the advanced stage of the disease in China and that these restrictions are easing, what are the strategies that are in place locally there in China in detecting and reporting potential clusters? What do nurses do in that situation?
Okay, thank you for the questions. Although China is in quite a stable stage during these 3 months or 4 months, such a painful experience during that 3 months, we still working hard on control all the cluster pandemic, cluster cases. So like in hospital or in community or in schools, peoples, students, health professionals, and also communities still working very hard in control the infections. We still wear masks, we still keep hand hygiene and keep social distance to prevent the re-outbreak. And for nurse in the community or in the hospital, we all educate family members and also patients and also community peoples on the hand hygiene and social distance and community and infection control. And also we also keep educate our student or future nurse to prepare themselves for the future communicable disease, how to cope with the future communicable disease. So, and also nurse play a lot of role in the follow-up surveys, follow-up investigate for the cases, for the suspended case and also the infected cases.
Yeah, so it's very much a long, sustained of monitoring, isn't it?
Yes.
So I would like to hear from Professor Xiaojing Ling. Particularly, you mentioned the use of telehealth, and that also it's been something that's been expanded upon, and there are a range of psychosocial considerations, however, with the use of telehealth. And I'm wondering what you think the opportunities are for the future. What are the barriers and enablers to using telehealth technology in nursing?
Thank you, Marie. We are actually reaching the fourth industrial revolution even before the pandemic happened. But with this virus, we are forced to actualize the fourth industrial revolution as a faster pace than we expected. So the fourth industrial revolution is characterized by a range of technologies such as Internet of Things, machine learning, artificial intelligence, and that are fusing the physical, digital, and biological worlds. So with this technology that will bring the smart healthcare, which also include healthcare, a reality. So this change will give us the opportunity that this machine will take away or replace us with take out the routine works and those works that does not require human interaction or does not require our intellectual. So we can spend our precious time with our clients, with our patients on more empathetic human interaction, which are not likely to be replaced by the machine. And also because nurses are at the front line of patient care, so we would know the patient experience the best. So this gives the nurses the opportunity to take the lead in this innovation process. So nurses can be leading and should be leading in this innovation process. And of course, there are some challenges. I would say it's a challenge instead of the barriers. I think the challenge would be, are we ready for this opportunity? Are we ready for these changes? So I think for the next generation of our nurses, we have to equip ourselves with the 3 following abilities. The first one is ability to communicate with human beings and ability to learn and work with machines. And the last one is the ability to surpass machines. So I think the COVID-19 definitely is a human crisis. However, it also brings us the opportunity for change that we have not seen in the past. So we should embrace this change and get ourselves ready to meet this challenge for the future. Yeah.
Wow. Do you have challenges with the older population adopting technology, or in your experience, have you found that to be relatively straightforward?
Well, you know, as actually elderly ability to use the technology is beyond our imagination. In almost elderly in Hong Kong, they are capable and they are able to use their smartphone and their smart device. So I think with adequate equipment and also appropriate instruction, I think we can take them step by step and help them to adapt that. So I think their ability to learn and adapt is beyond our imagination.
Oh, well, that's very good to hear. I think we make some assumptions about being older and technology, but that's very heartening to hear that. So Nolene, I want to ask you a question now. And in Australia, of course, we've had some challenges, especially in the early stages. Prior to the lockdown, we saw Australians ignoring social distancing measures and flocking to the beach and sunning themselves and really not heeding the public health messages. This was very early on. So obviously there's been a change since then, but I'm wondering what you think the major challenges are around communicating these public health messages, particularly around physical distancing, and what could we do to improve public understanding of the need for social distancing and really this marathon that we are on in terms of keeping the curve flattened and awaiting a vaccine.
Sure. Yeah. So I think the major challenge of communication during a pandemic is to, with empathy, quickly deliver consistent, clear and accurate, serious information that informs everyone how to prevent or minimise the adverse impacts. And the risk is, in part because of that urgency, and as has occurred in Australia, there can be uncertainty related to information overload, conflicting recommendations and duplicated efforts. So if we think about physical distancing as an example, I mentioned in my presentation that physical distancing means reducing close physical contact with each other. Now that seems really straightforward, yet many Australians have been unclear about exactly what it does mean and what to do. And that's because I think the emphasis initially was on the term social distancing, even though proximity doesn't align with social connection. And it's been explained and applied differently in every Australian state or territory. So, for example, in some states, in relation to physical distancing, some Australian schools are allowed to be open and in other states they're not. And the reasoning as to why hasn't really been explained. So, well, what can we do differently in the future? And I think time doesn't permit me to go into great detail, but I do think it's essential in Australia that, and nurses are to be involved in this, that we review what has happened during the COVID-19 pandemic, really, because it has been like an information outbreak. It's been overwhelming, and that we as nurses look to participate in creating a robust multimedia communications infrastructure before, dare I say, the next pandemic. I think for Australia, this has really been our first experience in dealing with something like this, and I think we've got a lot to learn in going forward.
Yeah, that's really important message, I think, there to think about different levels of understanding, and the conflicting advice has been a major issue here in Australia.
Much.
Yeah, the question that I have is for Professor Sue Park, and I just wanted to ask, you mentioned a lot about the educational opportunities for nursing. And of course, we've done a lot of online learning. We're all good at that now. I'm just wondering, in the future, what you think the major focus of educational opportunity should be out of this pandemic? Where should we move to next? What can we do differently?
Yeah, so I was thinking about two things. One is contents of education in the future. So, and the next thing is about delivery of education. So first about the contents of education. Before this outbreak, we usually focus on the patient with chronic disease management. We haven't focused on the population health or preventive nursing that much. So from this experience, we could more focus on this area before the next pandemic comes. And then second is about the delivery of education. So I think that every country is the same as Korea. Now for our school, we had online class using computer for like 12 weeks for now. And everybody got familiar with this online education. And we also use virtual simulation practice class through the computer for clinical practicum because the hospital shut down for clinical practice for our nursing students. So with our experience, we could develop more education method using web or technology, in addition to face-to-face education. So I think this is a good opportunity to think about future education for nursing students and nurses.
Yeah, fantastic. And I think the technology is there. It's just about our adoption. And there's always been a past few, certainly in Australia, that we need to have blended learning. And what we do, there's still important aspects of obviously psychomotor skill development, but we haven't really optimised our online learning. So the COVID crisis has certainly forced us to do that. Now we're nearly running out of time, but I wanted to take one last or ask for one last comment from our keynote, Anne. And of course, this has been a terribly stressful time for everyone, our students, our populations, and for us individually. And we know this isn't going to be the last time we experience an epidemic or pandemic. And we want to know really, what are the most encouraging signs that we've seen during this global crisis, and what hope is there for us and for nursing in the future?
Well, thank you so much for putting this together and for the opportunity for us all to learn from each other and to draw strength from each other. So thank you for that. I think some of the things that are incredibly powerful that we are drawing from this very concentrated experience is that we are really understanding, and it's an understanding that's really made widespread now across society. What should we really be investing in? We need to be investing in population health. We need to be investing in systems that protect the most vulnerable. In this year of the nurse and midwife, nursing has truly been made visible, and the contribution that we make is being understood. And that's not just marketing, that's so that we can really truly be unleashed to work with communities to make a better world. I think in a time period where the world's really been sundered by anti-science movements and authoritarianism, we're seeing that people do really understand the interdependence. And I think that that is a real source of strength. We have to dig deep through this crisis, because even in the midst of this moment, we can't miss this chance to rebuild society in a more equitable and sustainable way. And the vulnerability that we're feeling now can also be our strength when we come together to address it. As nurses, I believe we can help the world move beyond the forces that put us into this out of step place with nature. We can do that, and we will.
Yes, thank you so much, Anne. And I want to take this opportunity to really sincerely thank the panel members and wish them happy International Nurses Day and all the best. We look forward to collaborating with you guys all in the future, especially via the U21 network, but also on the international stage. So we're so grateful to you all for coming and sharing with us today. Now I'm going to hand you back over to Julia, who will speak about the next webinar that we have planned.
Kia ora koutou. Thank you, Marie. Wow, that was absolutely fantastic. Thank you all so much for joining us. And once again, a huge thank you to our global contributors for sharing their wisdom and experiences. The recording will be made available on the U21 Facebook page. Well, I hope you've all found this an interesting discussion and a worthwhile topic. My special thanks go to Professor Gertz, Helena Mujalka, and Karina Greenwood for helping us put this WHOI together. Now, our next webinar will take place in July this year and will be hosted jointly by the University of Birmingham and the University of Nottingham in the UK. We will send out more information nearer the time about the topic and the date, but I look forward to welcoming you back for our second webinar to celebrate the Year of the Nurse and the Midwife. Ka kite anō. Until next time. Thank you.
Thank you.